Oh hi, I'm back. I just made a video about trying to conceive and it was shorter than I thought it would be, so I figured why not make my next video about prenatal massage. So according to the American Pregnancy Association, you can start receiving massage at any point during your pregnancy, which is true. I've worked on people at 4 weeks, I've worked on people at 40 weeks. And you just treat it differently at different stages. That being said, you do want to make sure if you are getting prenatal massage that your massage therapist is certified in prenatal massage. Also, your massage therapist might not want to work on you during your first trimester. And if that's the case, please respect them. There's no scientific reasoning behind that. It's a purely emotional one. Your chance of miscarriage is significantly higher in your first trimester. And even though massage, there's nothing, like as long as they're certified and they know what they're doing and they don't do anything that's considered like a no-no. My cat's being really cute. Oh, he's so precious. As long as you're not doing things that are contraindicated, you're not gonna hurt that baby. But because the chance of miscarriage is so high in that first trimester, a lot of massage therapists just want to wait. They don't want that liability if something goes wrong. They don't want that emotional what if that just happens when something terrible happens, where you're like, what if I could have done something to prevent it? Or what if it was something I did? Which is completely non-logical, but it's who we are as people. Like a lot of the times you can't help but assign blame even when there's no blame to be given. Most of the time when miscarriage happens, it's no one's fault. It's just a terrible, terrible thing that happened. And it sucks. I don't have anything else to say about it. It just absolutely sucks and it's a terrible thing. And it's no one's fault. But because it's such a sad, heavy, emotional thing, a lot of massage therapists just want to completely avoid that. And if that's the case, then I highly recommend respecting your massage therapist's wish. That being said, I'm not one of those massage therapists. Some of your worst symptoms are in your first trimester, and massage can help like balance those hormones out and help with the aches and the pains. So I want to start seeing my adorable little pregnant clients the moment they know they're pregnant. And if they don't want to, I respect that too. Like if they're like, oh, I want to wait till I'm out of my first trimester. You do you. There's nothing wrong with that. But my eyeball itches. If you do get massaged when you're pregnant, it's actually very beneficial, not just for you, but for your baby. It can help you with decreasing like the aches and pains, so like back aches, neck stiffness, joint pain. A lot of pregnant women get swelling, and massage and edema are like this. Like, well, I can't do it because I'm holding a pen, and I also have a semi like busted finger that doesn't, anyway, not important. Edema is one of the things I love working on because you can see a difference instantly. Massage can just help clear it out. I had a friend who had like a massive baby and she was a tiny, tiny human. She had so much swelling. So I massaged her whole pregnancy and it made such a difference. So it'll help with edema, it'll help with aches, pains. It can also help with, I have a woman now who's entering her second trimester, and it's really cool because I get to be like, hey, your quads are starting to get tight. They're not quite there yet, but you need to keep an eye on that. You need to start stretching. You need to be aware that this is happening, so that way when you're like full-blown baby bump, you have done the pre-game work essentially to keep your muscles as loose and happy as you can before your mobility is decreased. Can also, this is a good one. So all of that like hormone balance, increasing circulation, decreasing tension, it'll help you sleep better, which is great because trying to sleep when you're pregnant is very difficult and getting comfortable is difficult. And like I said though, everyone's different. So if you're pregnant and you're watching this, you're like, I sleep like an angel. Good for you. Keep doing that. Live that glorious life. There's nothing wrong with it. If you're watching this and you're like, yeah, I can't sleep worth crap. Massage will help. Also, not everyone, some massage therapists, I have no problem having the partner, the spouse come in and me teaching them a few things and being like, hey, like you need to be doing this on a pretty regular basis. Some massage therapists don't like that. They don't want extra people in the room, which is understandable. Like generally speaking, I do not like that. But when it's educational and especially when it's prenatal and it's like, I want, like if the partner's up for it, like you can massage her pretty much every day, like just like little mini massages. So keep that in mind. It also, getting regular prenatal massage decreases the chance of preterm birth and a low birth rate. So it is healthier for your baby. And then as far as what a prenatal massage consists of, it depends on the equipment that your massage therapist has. Generally speaking, you're going to be side lying and they're going to have pillows for you to hold, pillow for under your head, pillow for between your knees, and they'll side lie and then you'll flip and that's how the massage will be done. If they're lucky, they'll have a table that like inclines. I have one of those tables, which is super awesome. So I have my people flip while they can. Once they're in their third trimester, if they can't flip, then we don't flip them anymore. They just start on the one side and then I have them move to their back and immediately incline the table so they're in a sitting up position. You cannot lay a pregnant woman flat on her back, especially after a certain point. I'd say that point is generally in the second trimester, but like I said, it depends. Everyone is different. I know some people who are at 14 weeks and not showing at all, and I have other people who are at 10 weeks and have like a good little baby bump. Depends on like if it's your first kid, your second, it just depends. It depends on a lot of stuff. So I will sit you up and that way you don't have that baby pressing on your vena cava, making you want to pass out, and then finish the massage that way. Some massage therapists have prenatal bolsters. These are really cool. They are also very expensive and I see 1 to 2 pregnant women a year. So it hasn't been something I have been interested in investing in, especially because I feel more comfortable with side lying when it's a prenatal massage because I'm not worried I'm going to be overexerting pressure. Like it's easier to control it for me personally as a therapist. So, but what the pregnancy bolster is basically like a giant block with a cutout for your boobs and belly. And that way you can still lay face down during your massage. But then when you flip over, they still need a table that either inclines or one of those wedge things, which I'm not a fan of, but to each their own. Every massage therapist has their own style. Just make sure if you are pregnant and you are getting a massage, it needs to be by someone who's certified or someone who's certified. Like I want to tell you it's okay when you're in your second and third trimester as long as the people are good therapists, and generally speaking it is, but there are some points that you need to avoid. There are certain things that can happen that like when you're prenatal certified you are prepared for, and when you're not you can be really taken back by. Also, if you are past your due date, there are points that we can work to help induce labor. They're very acupressure related points, but it is my favorite thing to do. I'm always a tiny bit sad when people's babies come on time because I want to be that hero that makes that baby come. But the most important thing is the health of the child. So obviously focus on that. And then I think that's it for as far as prenatal massage is concerned. If you guys have any questions, concerns, comments, feel free to leave them below and I will happily answer them if I remember to.